I've created this video for anyone who's uncertain about the difference between a total knee replacement procedure and a partial knee replacement procedure. I know the difference because I've had one of each. With a total knee replacement, more of the knee is removed and replaced. You can get an idea by looking at the picture on the left of the screen. Your surgeon removes sections of bone that have been eroded or damaged, usually by a degenerative condition called osteoarthritis. The surgeon replaces what has been removed with medical-grade, non-organic components. By the way, the anterior and posterior cruciate ligaments are also removed in a total knee replacement. With a partial knee replacement, the surgeon removes and replaces less of the knee. More of the original structure remains. Once again, see the visual to the left for an example. As you would expect, a partial knee replacement allows for faster recovery and rehabilitation. Generally speaking, a patient also benefits from a greater range of motion after surgery than he or she would with a total knee replacement. Risks involved in both procedures are similar. Parts can loosen, there's a danger of post-surgery infection, and nerves can be damaged. But there are several risks associated with partial knee replacement that you wouldn't normally have with a total knee replacement procedure. The non-organic components are more likely to need to be replaced someday. Revisions can be more complicated. If a revision is needed, the knee may function worse after the revision than it would following a total replacement procedure. Partial knee replacements are done less frequently than total knee replacements. Only 6 to 10% of patients are suitable candidates for a partial knee replacement. I've produced a number of other YouTube videos related to this topic. Click on the links below this video screen to watch them.